Who gets vaccines? This is the question everybody wants. And Jason and I were actually just talking about this. So right now, both of the places that we live in, we are still in category 1A, which means it's healthcare personnel and people who live in long-term care facilities. So if you're in an assisted living or a nursing home, you may have already received your first shot, or you may know people who have. Some states are now starting to move into category 1B, which is people over the age of 65, or over the age of 75, sorry, and some essential workers. So these are people like the bus drivers, because we need them. The one thing with these categories is essential workers are defined by the states. So each state will have a different definition of what an essential worker is. So how they do that, how they define this, will vary from state to state. Now, the next category of people are people who are 65 to 74, and people between 16 to 64 who have a high risk medical condition. So this is diabetes, potentially diabetes, cardiac disease, chronic lung disease, if you're immunocompromised, like you've had cancer. So, but as I said, this may vary from state to state. The CDC has not defined this high risk medical conditions. They have left it up to the individual states. And the final group within this tier of 1C are other essential workers. So these may include grocery store workers, the people who work at the gas stations, your mechanic. And the final category is all other people over the age of 16. Now, as I mentioned before, none of the vaccines have been tried out in children. So as of right now, there are no recommendations for vaccinating anyone under the age of 16. So children will not be vaccinated. Your local health department is the group that determines how your vaccines are distributed. Now, to find out what your particular state is doing, the CDC has created a website that allows you to link through to your state. So it's www.cdc.gov/2019-NCOV/vaccines/index.html. Now, I've had a couple people ask me, how come the federal government did all this work to put out guidelines, and then each state still gets to choose what they do? Unfortunately, there was no coordinated federal response for how the vaccines were to be administered. So the best that the CDC could do was put out guidelines on the priorities of who gets it first. But states are still allowed to make their own decisions. For example, Maryland is following these guidelines, and they're in category 1A right now, whereas Florida has created their own guidelines and opened up the vaccines to anyone over the age of 65. They had a different priority. And why do some states seem to be doing a better job of getting vaccines to their residents than other states? Valid question. A lot of it has to do with the existing public health infrastructure within the state and how much money the state government is putting towards the rollout. The other issue with this is states didn't officially know that they were going to be responsible for the rollout until October or November. And by then, it's hard to build out the needed infrastructure in a month or two, because you're talking about vaccinating millions of people.